link with other medical students or healthcare professionals and feel supported when you're feeling overwhelmed with work or the pressure of being a medical student is really getting to you. It's also an amazing way to network. We have currently almost 800 people watching us from 60 countries all over the world, and every single one of you was reached through social media platforms. So you can really understand how powerful these tools can be if used in the correct way. So thank you ever so much for enlightening us about the use of social media once again. I am now going to introduce our next two speakers, Dr. Sharlini and Miss Fee. So Dr. Sharlini is an ST2 core surgical trainee and aspiring breast surgeon at Southend Hospital. She qualified from Barts and the London School of Medicine and also has got an intercalated BSc in global health, which she achieved in 2017. She's also a founding member of the Essex Surgical Girls. We then have Miss Fee, who is an ST2 in vascular surgery at Northwick Park Hospital. She's an alumna of the Imperial College of London and was a medical education academic in FY1 and FY2 at Basildon Hospital, just close to our university in Chelmsford, Essex. This is where she fell in love with surgery, met Sharlini, and helped us starting the Essex Surgical Girls program. We also want to congratulate Fee for passing her surgical exams. She's now Miss Fee Lewis, so congratulations from us. This will be a bit different. This will be a little bit different from the talks we've had because our lovely speakers have asked us to prepare some questions on the topic of mental health and surgery, which I will be discussing with the two of them, as well as Ines, which will join us back soon. We want to thank Sharlini and Fee for joining us. This is the third year that they actually join us for our Women in Surgery panel discussion, and it's always a great honor to have them, and they're super inspirational for us. So thank you so much, guys.
Hi.
Hello. Hi, guys.
Hi.
How are you?
Hi, Shells. Hi, guys.
Hi, everybody.
I'm good, thanks. How's your conference going? It's been really great and inspirational so far. We're really enjoying it. We were having a lot of fun as well.
I just want to say,
awesome.
it's such an honor to be on the platform with such amazing surgeons. I've been listening from the morning. I've just been so inspired and picked up so many things. So yeah, it's going really well. Well done, girls.
Anna, do you want to explain how this is going to go now?
Yes, you might have a little bit of echo because Ines and I are actually social distancing in the same room, so apologies for that. But yes, we have drafted together a series of, I want to say, 12 questions that we're going to ask you, and then whoever wants can just raise their hand or tell us, I can go first, and we can get through them.
Sounds good.
Should we get going? Perfect.
Yeah.
Right, so the first one is, what is important to do and think in order to maintain a good mental well-being?
Fee, you can start this one.
Okay. So I have something I say to myself, which is you can love surgery, but surgery will never love you back. Which is kind of means that you can pour all your energy and all your time and your effort and your smarts into surgery, and it won't give you much back. So you kind of have to pour all that energy and effort into stuff like looking after yourself and your friends and your family who are going to look after you too. Because it can be very enticing to spend all day, every day operating, but it is not sustainable.
I would agree with Fee in that. I think it's important to remember, I think this is the same for if you're a surgical trainee, if you're a medical student, if you're any kind of trainee. It's important to remember that you're a person as well as a trainee. And sometimes the pressure of something like surgery, it's sort of, you forget that you're a person too. So I'm going to start with the basics. And it might sound like common sense, but actually I have found that as I've progressed from F2 to CT1 to CT2, I've stopped doing these things and I have to remind myself. So sleep is really important. As we go more and more senior in our sort of training, we think that we can somehow get ahead by sacrificing sleep. You will not get ahead. You might get a day or a couple of days where you get a bit of extra work in, but eventually it'll catch up with you and lead to other problems. So I know it sounds like a cliched thing that everyone says, but take it from someone who was not very good at sleeping and did not prioritize sleeping and started to see the like negative side of that, sleep when you can. There will be times as a surgical trainee, you know, as a doctor, as a medical student, that you can't, for example, when you do an on-call shift and you have to come home, there'll be times when you can't, but when you can, catch up on your sleep and always aim to be sleeping like well rested. That's really important, and it filters into your work, it filters into your eating habits, everything. Similarly, eating well and some form of exercise. You know, I know not all of us can go to the gym regularly or, you know, go for a run every day, but if you can do some form of exercise. I know my registrar at the moment, very good, she's a mum and surgical registrar, and she's got herself a little Fitbit and she does a few extra laps around the hospital when she's got time, and that's such a good practical way of making sure you're doing a bit more exercise. And water, really important. Water sounds silly, but you need to hydrate. Like, it's a well-known thing that all of us doctors probably have, like AKIs if you like tested our bloods, but make sure you hydrate. I've got a water bottle that's got like a reminder. I mean, everybody in the hospital knows me for this water bottle. It's really embarrassing, but it's huge, a 4-litre bottle, and it's got a reminder. You can get this off Amazon, and it tells you how much you should be drinking, and it's sort of like your daily intake. And when I took it to the hospital, people were like, that's my month's worth of water, that's what I drink in a month's time. So it just reflected that, like, we don't drink enough water and we don't sleep and eat well. I think the other thing to say is be kind to yourself. I really liked what Miss Shake said in the very early talk, or I think it was Miss Lang, who said, teach yourself to be your best friend. And I think that's really important. As you progress, when you're an F1 or an F2, you've got lots of colleagues, a medical student or an F1 or an F2, you've got lots of colleagues, you've got a batch of 30, and you will have a friendship group and you will have people that you relate to. But as you go more and more senior, so for example, as a CT1, CT2, you might only have 4 or 5 of you in the hospital, or even less sometimes. In some hospitals there's only 2 of you, and if you don't like the other person, or that person is not someone that you get on with, or you start to become, you know, it can become quite lonely, and it can become quite a lonely journey. So teaching yourself to be your best friend, and being really kind to yourself, I think is really important, and we'll talk about that a lot. I don't want to take over. Fee, chip in with you had some like really good things that we spoke about earlier.
Something that I was taught before I did a laparotomy or any surgery that has the potential to go really, really long is you always eat, you always drink, and you always pee. And I think that is like a good rule for surgery, good rule for life. It's like, eat when you can, drink when you can, pee when you can. I can vividly remember the last medicine on-call weekend shift I ever did, and this is like 2.5 years ago now, because I didn't eat till 4 p.m. and I didn't pee from the start of my shift till 4 p.m. and I was so miserable, and I was like, I'm never going to do this again. And I never have.
I think as a doctor, where self-care is the market, it's peeing when you need pee. I learned this one year.
Sharlini,
is it lagging?
Yeah, it's lagging a bit.
Hello, still hear me?
We can hear
Everybody's
you,
frozen
but
on my
the
screen.
video is frozen. Yeah.
Okay.
Oh, yeah. There we go.
Okay, cool.
Yeah, I was gonna say it was in my CT1 years that I discovered that, like, as a doctor, like, peeing is a form of self-care. Like, when you need to pee, just go and pee. There's always going to be someone who's unwell. When you need to drink the but
It's
to appreciate that someone's always ill, and that's why you're doing your job. If you're withholding your sickness, then that's going to interfere with your ability to do your job properly, in essence.
Is it still lagging a bit for you, Sharlini?
Yeah, Shalini is a little bit, but
Sorry,
you were lagging a bit, but don't worry about it. Yeah, even if the bleep's going off, I wrecked 2 of our general surgery on-call bleeps last year by one dropping it on the floor when I went to pee, and then the second one I dropped in the toilet and it broke. So yeah.
I feel like as medical students, we still we still don't prioritize drinking, sleeping, and even peeing sometimes. We're just studying in the library, and we think, oh, I'll go and pee in like 1 hour. I have time. It's fine.
No, do it now. Learn it now.
Exactly. No, I've learned that. I've learned that. Don't worry. Yeah.
They're essentially habits. So like when you feel like you need to pee, just get into the habit of getting up and going. And also I think the water bottle or a visual reminder of the fact that you need to drink water is a good way to make sure you're drinking water. And I think it's a good habit to get into from sort of medical school, because when you start working, it will become harder because you have external pressures that tell you you need to do this and you need to do that.
I should probably get that bottle that has the line.
I will send a link to that bottle, hopefully at the end, and then hopefully you got.
Oh, I love this. Yaz, so, am I allowed to say questions from the Q&A? Because there's a great question on the Q&A that's just come up.
So
sure, I think you can ask that question if you want.
It's on the top. It's on the topic of peeing, which is very important, especially for ladies. Says, how do you cope with long surgeries, and do you need to go during? Do more senior doctors look down on people who have to take breaks? So I pee a lot. I have never had to pee in a surgery yet, and I've done 7.5 hours. But I have had a registrar or two take a break to go pee. So
they also take breaks as well.
Yeah, you can take breaks. Like if you need to pee, just go. Like just leave, just de-scrub. But aim, ideally not in a critical moment, but you would be surprised, I think, how little everything else matters when you're standing there operating. You don't get hungry, you don't get thirsty, you don't need to pee, you don't get tired.
Also, I've got to say, if somebody I've not had this experience either, but if somebody is going to look down on you because you need to pee, then that person's opinion doesn't matter. You need to put yourself first, and you need to make sure that you're meeting those things. There's another type of people's opinions that you should be worried about, or you should be worried meeting. So don't worry about that. If you need to pee, you pee. That's the rule.
Our next question is there something that you do in your daily routine to ensure you're not overwhelmed as well?
Yes. So I think there was a really good analogy that I want to speak about for this. So as I've gone from F2, I think F1, F2, you're a medical student, then you do F1, F2 where the job is horrific, but to some extent you can go in, do the horrific job and come home essentially, and then have your time to do you. But then as you sort of think about specialty training and what you want to do, you start having to balance your work, your portfolio needs and your training needs and things that you need to do, your social life, etc., etc. So I am a huge believer in like spending some time planning what you're going to do. And I like this analogy of the pilot, the plane, the engineer, which I think is quite good. I came across it quite recently. So it's sort of like a mental model for productivity. And there's 3 versions of you. There's the pilot, and the pilot's job is essentially to set your course, your goals, your direction. And that's the person that decides what you're doing on a given day. So you should probably spend about 10% of your day being the pilot. So that could be in the morning, like when you're having your breakfast or coffee, or it could be in the evening before you go to bed when you're thinking, oh, well, this is what I'm going to do tomorrow. For the majority of your day, around 85%, you're the plane. So you're executing what you've decided to do as the pilot, essentially, like I'm going to do this, this, and this, and then you can just get on with it. Look at your list or look at whatever you've made and get on with it. And then the third part, the engineer, is your job is sort of to help the pilot. So create the systems, the to-do list, the calendar, the sensible file storage system, the things that are going to help you achieve your goals in a way that's very good, basically. So I quite like that, and I think that's helped me a lot. So I spend a bit of time in the evenings or in the morning doing that. And when I don't do that, I can sort of see that I'm losing control of my, what I'm supposed to do, and I'm not able to track what I've done. So I think that's quite good, and that's helped me from being overwhelmed. The second thing I think that's been quite good as things have gotten more and more challenging, because I have found CT1, CT2 quite challenging, quite stretching, a bit of a push, especially with COVID and everything that's gone on and how that's limited my training. What I found was quite good is in the mornings, this is from a productivity coach. Both of these things are stolen, they're not my own. So I'll attribute who I need to attribute, but this is from a productivity coach that I follow called Brendan Bouchard, who I think is very good. But he says that in the mornings when you're thinking about your day, think about your anticipated challenges and what you think is going to be challenging, and then think about how you might overcome them. Because if you think about it, we go into situations and they can be really stressful, but actually we probably could have predicted that a certain situation was going to be stressful, or we were going to find this exam difficult, or we were going to find this revision stressful, or whatever, or I was going to find this particular theatre with this particular person very stressful. And if you can anticipate the challenge and say, well, I think this is going to be quite hard for me today, but I think this is how I'll deal with it, then that will help you deal with it in a better, more productive way and make it feel less, because even though we know these surprises are coming or these horrible things are coming, we're like, oh my God, that was horrible. Whereas actually, if you've predicted it and you've come up with a bit of a plan for yourself, it helps. So that's quite good. Fee, I don't know, I'm sure Fee has some wonderful things to add.
I love the plane engineer and pilot thing. I've never heard that one before. I'm going to use that now. It's good. I'll
credit that to the Abdal.
Okay.
Sorry.
It's fine. The way I think about it is that I need to be the best Fee I can be, and if I am top Fee, then I can handle pretty much everything, and I just let it wash over me. It's only when I'm not top Fee. So I do that. Everything is prepared. I do everything the night before, so I have all my breakfast and my whatever. All I have to do in the morning is like shower and get dressed and go out the door. I always get to work early, and I always check theatre lists. I always check, ward stuff. So it's all just about kind of preparing. So when I have that official kind of ward round meeting, and I've done this since F1, it's just, I like it, I prefer it this way, then I know I'm prepared. And then I know that even if, for example, what sometimes happens, somebody's really sick, and at handover, they're like, someone's really sick and you can't do anything else. You've got to go at 8:02 to that sick patient. I know that everything else is sorted. What else do? I do my work at work. So I've actually just recently got an office that I share with people, which is a luxury. And I tend to do my work at work, and then I can come home and be like, all right, that's it, I'm done. I'm going to make myself a nice dinner and chill out, which is, I think everyone kind of finds their way that they work for that. Also, I take Friday evenings off. I've realized that I am useless on a Friday evening. There's no point in me doing anything. So Friday evening is wine and friends time.
Sounds good, thank you. And we've kind of touched on this, on what Sharlini said, for exams being stressful, but we thought of asking you this question. Mm-hmm. How do you feel about exams? Do you often get stressed by them, just like us students? What are your techniques to ensure you stay healthy during that time? I know I personally I become a nervous wreck when exams are approaching, so please share some of your valuable insights.
So, I'll say my spiel on exams and then let Fee take over. Exams have been a huge limiting factor for me. I would call exams my nemesis, because they are the single motivating limiting factor that's been sort of throughout from medical school. I've struggled with them. I still struggle with them today. And I think I've a particular soft spot for people who struggle with exams, because I have been through that the same, and I've had a period of sort of anxiety and stress and nervousness related to exams, which further debilitated me more. So I guess for me, the process has been coming out of that and managing it, etc., etc. Now, I think what I think I realised is that although we all get taught what to study from when we're in school, we get told what to study. I think not a lot of we're not taught very well how to study. And I think as you start learning huge volumes of things, like you do in medical school and like you do in postgraduate exams, it becomes difficult to grasp everything you need to grasp. So ways to pass exams. I personally believe that you need exams and you do need to sort of get through them to be able to progress with your career. But I don't think there's a huge correlation between people who do fantastically well in exams and people who make excellent doctors. So there are lots of different ways to pass exams. I would say have a plan, be organized, find study buddies, but also find your exam tribe, find the people that you know work like you or have the same issues as you. If you're somebody who struggles with exams, really look deeply at your study technique and spend time thinking about how you can improve your study technique. And at this point, I just want to recommend someone that I recently discovered who I think is absolutely excellent. I'm sure you guys have heard of him before. There is a YouTuber and podcaster called Ali Abdaal, who is a Cambridge graduate doctor, an F2 doctor. I think he's doing an F3 year now, but he produces loads of content on how to study and also how to be productive. And he's got this, I think it's either 24 or 34 part series on how to study, which is specially tailored towards medical students. And to be honest, I think it's excellent. It's stuff that I need to know too. So I'd highly recommend that. But there are lots of people like, there is lots on YouTube and Google on how to study and how to improve your study technique. There are Facebook groups that you can join for certain exams. Just remember with exams, you just need to know what they want and do very targeted, specific revision towards that. And I'm a huge advocate of past papers and past paper questions and things like that to test your knowledge, but also tracking your progress and seeing how you're doing and making sure that you're improving is really good. So that would be my general advice. Fee. So Fee has just passed her part B, so congratulations. It's fantastic.
Thank you.
She's excellent.
I super stress about exams. I am like a real stress freak. I think we all do. Actually, no, that's not true, because the boys, this is a generalization, but the surgical boys don't. The surgical boys turn up and they're like, yeah, I know stuff, and they walk in and they're fine. Whereas all the girls I know freak out about it. I don't know why. I'm from a big med ed background. So I'm big into revision and study strategies. I used to teach people, teach revision courses, actually, how to pass your exams and stuff and how to improve your grades. So if you do want targeted stuff, tweet me, because I have loads of tips. But there's this idea called deliberate practice. Deliberate practice is if you want to get better at a skill, and the skill is passing the exam, you have to practice that skill. You can't learn the knowledge. So basically, if you're going to do a multiple choice exam, you got to do the multiple choice questions, similar to the ones in the exam. If you're going to do a practical exam, like my one I just did, you're going to have to do the practical stuff. Like you can have a knowledge base, but if you do not have the skills, it's not going to work. It's not going to happen. Study buddies make everything better. Again, I wouldn't have passed my last exam without my little study crew. And sometimes you have to be the one organizing it, and that's okay, that's cool. But also, I think a really big thing for me this exam was realizing that it's totally okay to fail. And just because you fail one exam doesn't make you a failure, especially postgrad exams. Like 2/3 of people fail MRCS Part A on the first time round. It's statistics. And also, but we are, as medical students and as medics and surgeons, it is hammered into us that you can't fail an exam, you can't fail, or you're a failure. And that is not true. Like, so much of exams and so much of doing what we do is down to luck. It's hard work and luck. And if you don't fail, if you don't pass, you take it the next time. Yeah, it is what it is. You learn more.
I thought there's a really good question that's just been asked. It says, how do you manage to stay motivated despite all the constant rejections in a highly competitive profession, e.g. not ranking highly enough to get the post you wanted, your paper not getting published, failing an exam, etc., etc. Now, I think that's a great question. And as someone who's failed my Part A a couple of times, I can, it's difficult to stay motivated. And sometimes you feel like maybe you're the only one that's in a situation, etc., etc. I think it's important to start to think about yourself, and you have to, I know we'll talk about competitiveness and comparing in another sort of slide, but when you are struggling and when you're in a situation where you're struggling, you have been rejected, it's important to stop thinking about other people, take yourself out of the race and focus on yourself and how you're going to improve to be better. If you focus too much on, you could either take the route of I hate myself and I'm terrible and I've done such a horrible job, or you can take the approach of, okay, well, what have I learned from this? It's a failure. It's not related to, I'm not going to relate this to my self-worth and what I think of myself as a person. It's just, this has happened and this is where I want to go and this is the failure that's got in the way. How do I now get to the next stage? And you break it down and you break down your process and you focus on the things that you need to do. And then that's how you do it. You take it, your self-worth is not determined by your ability to pass exams or your ability to, you know, get into a training job or your ability to get the poster you wanted or your paper being published. That's not your self-worth. And I think, honestly, the people who do succeed and come out the end are the ones that can embrace failure. And it's your biggest, if you can see it as a lesson, your failures will be your biggest teachers. If you can really dissect it and say, where have I gone wrong? What can I do better? What did I do here? If you can do that, and that's self-care. That's a process of, if you've got high self-esteem, you'll do that because you care about yourself and where you're going. You'll say, well, where could I go better with this? In order to do that, you really do need to not compare yourself to others and not be looking at other people and think, oh, well, she's here and I'm still here, and etc. It's a really good poem. It's probably a good time to bring up the poem. There's a really good poem called The Man in the Glass, and I'll link it at some point during this talk. But the poem is all about the only person that you need to essentially, you know, make happy or be true to is the person in the mirror. That's yourself, and you're a different person from the other person who's passed the exam or whatever. So focus on yourself, work on yourself. And I think I'm not going to say, oh, you just need to focus on yourself and like everything will be fine. You need to make sure that you are improving from, it's your personal best and you're reaching. So even if you try again, as long as you've improved from the last time and you've done a considerable amount of effort, put a considerable amount of effort into it, then that's fine. Keep your eye on what you want to do, and the process. If you fail, let's leave it at this. If you fail, so let's say you fail an exam or you don't get into a job or something, the only way you're going to feel good about that, to come away from that and it being a positive experience, if you learn from it and you pick up certain things and you say, oh, I'm not going to do this again, I'm going to do this again, or I'm going to do this better, I'm going to do that better. So you might as well, because being negative about it and is not going to help you, if that makes sense. I hope that answers the question.
No, it definitely does. And it's interesting how the same tips for you that we can use as medical students as well. I feel like, and it's interesting to see that even if at the time you still heard all of those tips, it's still like you still need to hear them from someone else for you to actually act on them. So we are aware of those tips and people tell us about those tips every day, but only when we actually live that experience and we've been through that failure ourselves is when we learn and wake up and be like, okay, move on.
You need to be constantly reminded.
I'm going to tell you a secret, which is even when you have your top choice surgical job and you're doing really well and everything looks great and you're progressing, you will have days and be like, man, I want to quit. And that's okay. Like, I think it also, whenever your days are like that, and it's so easy to do well and keep working hard when you're motivated and everything's going well, but it is when it's when you're not motivated. It's when it is the middle of winter and you're staying late to do a laparotomy or whatever, or you're like, why am I not progressing? And that is when you really learn what you're made of. And I think that's really important. And the power to get up in the morning again and keep pushing. And every single time you do that, from medical school through F1, F2, through training, you are just, you're building yourself up to be bigger and better and stronger.
That's a great message.
I'd just like to leave you with one point, which I think is really helpful, just because I'm super passionate about this. But if you are being rejected, I know that on exams, they've recently increased the pass mark to like 77, which is impossible for the Part A, and lots of people have failed. They've also made it much harder to get a training job. Like at the moment, we're faced with the reality of trying to get a training job is being rejected by lots of different people. And I think what you need to do every time you have a setback is to talk to yourself the same way that you would talk to your child or your best friend, someone that you really care about. Yeah. So talk to yourself as if you are your daughter or your son and how you would advise them, or how you would talk to your best friend. And when you start talking to yourself in that way, you know that if you said to your daughter, well, you just did really rubbish and you did such a crap job, and you know you're not going to succeed, she's probably not going to do very well, is she? So if you apply those same principles to yourself, you'll know better how to sort of nurture yourself and like lead yourself to success, essentially. So that would be my advice.
Yeah, that's a great tip. So the next question is, if you ever suffered from imposter syndrome, and could you tell us an instance where it happened and how or if you ever actually overcome it?
Oh, can I start with that one?
Yeah, I was definitely start. Yeah.
So I have recently I started a new job at the beginning of October, so kind of middle of October. So I've done it for about 3 weeks, and I'm an ST2, so I should be an SHO, but they don't have enough registrars, so I'm a registrar. This is a very big step up, and they told me 4 days before I was supposed to start the job. So basically, I'm in a position that, been in a position that I don't feel like I should be in for the next year at least, and I still thought in the next year I wouldn't be qualified for. So I don't feel qualified for it. It's very unfamiliar to me, as I haven't done the particular kind of surgery since F1. And every time I pick up the damn phone, I'm like, I feel like I'm a child playing dress up. And, you know, even like the angio nurse, the first time I scrubbed in for an angio, was like, you've brought a medical student in, and they're like, no, it's the vascular registrar. And I think I've got less, I'm still feeling a lot of imposter syndrome for it. But I think with experience, it's kind of helped. It's kind of, I've done the job. I haven't killed anyone yet, touch wood. I've listened to advice. I've got advice from sensible people. I follow it. I hear my mentors' voices in my head, which is really stupid. But like, I hear them saying, don't let the jobs pile up and go see everybody. And I'm really honest about it as well. Like, I turn up to see a referral and they're like, do you know what to do? And I'm like, no, I'm going to call my consultant. I'll be back. And I think that wins a lot. Like, you can win a lot on your honesty and your social capital. But yeah, I think we all feel imposter syndrome, and I felt it at every single stage of medical student and doctor and trainee. And the things that, weirdly, I don't know, passing the exams and getting the jobs has helped, because you're kind of like, empirically, people are like, oh, you're coming in here to do this, and you're like, yeah, I've passed this exam, or yeah, I'm the trainee, and people are like, oh, okay. And kind of when you get that respect from other people, it kind of makes you feel in your head like, actually, you know what, I can do this a little bit. So
yeah, that's really good stuff. I don't have much to add except to say that 90% of the time I have imposter syndrome. I think when you're in a job, I'm also an IST2 trainee, and when we got the jobs, they were new, well, the second year of rerunning the run through. And although I'm so grateful for the job, I think it's amazing, I didn't expect to get it, and I'm super grateful for it, there is a lot of pressure on, oh, you're an IST trainee, you must be this and this and this, and no, I'm not. I'm just a core trainee trying to become a surgeon, essentially. So I have imposter syndrome a lot of the time, but I think some of the earlier talks, they had some like wonderful advice about, as women, we all have imposter syndrome, and we all think we're not as good as we are. It's not all, but we have a tendency to be that way. And I thought the advice earlier, which is that you have to practice casting it aside. You have to practice it. Some things are just habits, and you just have to, as a habit, even if I feel like I'm not supposed to be here or I've got imposter syndrome, I'm here to be trained. That's what I'm doing. I'm going to cast aside the imposter syndrome and focus on things that I can control. Like, imposter syndrome is not really something you can, you can't do anything about imposter syndrome except feel it. But what you can do is cast the imposter syndrome aside and say, well, I'm going to come out of this experience and have learned 2 or 3 things more. So that would be my advice. I also wanted to answer a couple of the questions. Is that all right? Yeah. Okay. So somebody's asked, how important is it to organize your time schedule in advance and attach to it? I think it's important to be organized and have a plan in place. They always help. However, I think it's really, really important to be adaptable. Now, when you have any kind of revision plan or plan towards a goal or whatever, you need to be able to adapt that plan. And that's the same with sort of your life and your training and your career, all the way down to like your exams and your applications and things like that. Earlier, there was a really good picture of your anticipated pathway and what actually happens. And I think it's nice to have a plan, because it's good to have goals. It's actually proven that goals make you happy. Having goals make you happier, and aiming for things make you happier. But with all the same, you have to be able to adapt to them. Even with the revision, I remember last time when I was studying, I'd have this plan, and every night I'd go to sleep thinking, oh, I'm not going to have time to finish things, I'm behind on my plan. But then I'd wake up the next morning and spend some time, a couple of minutes, thinking about how I was going to approach it in a way that made it more manageable for me, or how I was going to adapt the plan so that I could fit things in. So I think always be have a plan, but always be ready to adapt them. That was really good. And the other question, I hope that answered the question. The other question, which I got a really good answer for, I think, is I often find myself procrastinating, even if I like the stuff I should be doing, instead of procrastinating. How to be more productive and spend more time doing what I really need to do. Okay, so I discovered this thing, I'm sure a lot of you know about it already, called the Pomodoro Timer, which is excellent. You can get it online. You can get a little, somebody bought me a little kitchen timer that's a tomato, so it works like that too. But what I think is really good about that is sometimes you feel like I've not done any work today, even if you have. Sometimes you feel like I've not done any work today, and you actually haven't done any work. So what Pomodoro does is it's 25-minute chunks and 5-minute breaks. And what I think you can do is, if you say, I'm going to put this timer on, I've got a little, for exams, I've got like a Pomodoro table that I've just made on Word, and it's got about 12 Pomodoros a day kind of thing. I can link that. But what it does is you just write on a piece of paper. If you can just do a tally chart of all the Pomodoros that you manage, what you're then doing is you're tracking the amount of work that you're actually doing, and that's an objective measure of how much work you've done. So if you've done 10 Pomodoros, that's 10 times 25 minutes. You've done that many minutes of work, and nobody can contest you on that. 25 minutes is a really good, nice chunk to motivate yourself, because you're like, I only have to do this for 25 minutes. And the hardest bit is always just starting. So I would highly recommend the Pomodoro method. Use it in a big way. It's also good when, say, you're trying to study when you're at work. I found it was quite good. I found that quite difficult. But then I would just go, if I had like a free afternoon or free couple of hours, go to the library and just say, I'm going to do 3 Pomodoros. And that's how I'd like record the amount of work I did. And then I'd be like, oh, well, you've done sort of like 1 hour, 15 minutes of work today. So for people who struggle with procrastination, which is, I'm pretty sure, most of us, that's a good technique. And there are other ways to overcome it. Just make life easier for yourself. We're humans, we make mistakes, so find ways of like getting around it that make it easier for you not to procrastinate, if that makes sense. Get rid of your social media apps. Like sometimes I delete my Instagram and Facebook, so if I want to look at it, I have to re-download it again. Things like that. Yeah, that's it.
I find it's really funny, kind of the difference between Sharlini and myself, because Sharlini is like super organized and does all the revision plans and everything, and I am actually currently being assessed for adult ADHD, and I was always like, why am I like this? And the answer is ADHD. So plans don't really, well, they kind of work. They don't really work for me, because sometimes I'm hyper focused, and sometimes I can go through the whole of hematology in a day, and sometimes there is nothing that will make me work. And it's like, there's no point. It's like beating your head against a brick wall. So something that I do is I split my kind of stuff up into high focus and low focus activities. And high focus is stuff that you need to be super, you need to be in the zone on it. And low focus is stuff that you can do with like music or a podcast or TV in the background. And that can be stuff like marking, past paper questions. And that's still studying. And that's important if you're like, my brain isn't up to it today. And for the high focus stuff, I like the Pomodoro as well. It's really good. I have a million checklists because I have to check stuff off. What else do I do? I have a Get Pumped playlist, and my Get Pumped playlist is only used to start off a revision session or before an exam. and I will share that, but you guys probably don't have my music taste. But yeah, you've got to, or I've got to have my coffee, I've got to have my work set up. I do, I know I have all my materials. I eliminate choice, because choice is really difficult for me. So whenever I'm studying for an exam or for something, I never have like 1,000,001 different kind of resources I'm going to draw from. I have like 2 or 3, and that kind of helps separate out stuff for myself. And I do things in blocks. So I'm not going to do like an hour of anatomy and an hour of pathology and an hour of physiology. It's got to be like a whole afternoon or a whole day that you get. And these are all things that you learn. And I think that Shalini says the starting is the hard bit. Like if you can get past that little like that thing, and so much of the time is because you're like, I don't know anything and I'm scared I'm going to fail this exam. And you know what, babe, if you don't sit down and study for it, you will fail the exam. That is life. So you gotta be a little bit scared. You gotta get over it. Fear is useless and temporary.
I think also, if you're like me and you can fall into the trap of like getting really sucked into revision and then getting really depressed about how you have nothing else going in your life, I think it's actually really important to schedule in nice things. Now, they don't have to be dinners, or they don't have to be elaborate things that take lots of time. Now with Zoom, like I'm using Zoom a lot more socially, but scheduling prior your fun hours and make them non-negotiable. Like, you anticipate that nearer the exam you're going to have less time to do things, but in the weeks before the exam you can go to lunch, you can have a movie night at one night to sort of relax. But if you don't schedule them in and you're sort of in the intense throes of revision, you're going to be like, I can't do this, I have to keep revising, and then eventually you're going to burn out and not be able to do anything. So scheduling fun basically during difficult times and revision times, that would be my other advice. Yeah. Time is going quickly, isn't it?
Yeah. I found it funny what Fee said about the playlist. For the people who know me on this call, they know I have a specific playlist when I need to start studying, which is good. I actually find it helpful to study with someone on a YouTube video. So there's some YouTube videos of medical students studying, and I like studying with them in a way that like they force me to keep going. And I pretend that they're looking at me from the other side.
Oh, that's cute. I like that. That's really cute.
Yeah.
Anna?
Yep, next question will be from me. I know we've kind of touched already upon it, and it might seem a bit personal to the people listening this call. So don't worry, I'm not just throwing them off the game. We've told them we are going to talk about this. So have you ever suffered from depression, anxiety, or other mental health problems? And do you believe these are often perceived as a barrier for a career in surgery?
Fee, I'll let you take this one. I'll add.
Cool. Yeah, sure. I am probably just coming out of / at the end of, like, it's very hard to tell, of about 16 to 18 months of anxiety and depression. And yeah, which really sucked. And it coincided with like a really good time in my life career-wise, like a time that should have been, really great. And I think it did used to be, a big barrier for kind of surgery, and you did have to kind of be the macho or the whatever or the strong person. But I have not had that experience. I have had a really good experience. I have had an experience where I had a lot of support, and then I went to my educational supervisor, who was very supportive, and she is like old school hardcore surgeon, and she's lovely. And then I went to my clinical supervisor, who is like old school, like general trauma, like rugby boy. And he was like, I had depression too, and I had it in this point of my life, and I took a lot of time off, and however much time you need or whenever you need, you just let us know. And it was really great. And I kind of segued to being quite honest about it at work, and I did have a few registrars. I'd say, today is a really bad day, or today I'm feeling really anxious, I need to do work. And he'd be like, okay, you're going to be in charge of the list today then, and that would really help. The way that I found it was that actually I was okay at work. I was perfectly fine at work, and to the point that I kind of put a lot more emphasis on work than everything else. And then outside of my life, so the rest of my life wasn't as good. And So something that I've been learning to do as I've got better is to take back kind of more control and more time on my personal life. And it's not perfect. I had a very stressed week this week. And I had to kind of be like, you know what, I'm saying yes to too many things and I need to kind of put it to one side. So many of my surgical trainee friends actually, since I've talked to them and been like, you know what, I've had mental health issues, I've got them, I'm going to therapy. They're like, you know what, maybe I'll go to therapy too. And lots of them are finding it really helpful. Like you are never alone, basically.
Absolutely. Thanks for sharing, Fee. I think it's really important to remember that being a surgeon or being a doctor is not more of an urgent priority than being mentally well. There's sort of stress, and there's work-related stress, and we all struggle with stress, but then there is a point at which the chemicals in your brain start making it very difficult for you to function. And the bad thing about mental health is that you can actually cover it up for a really long time, and the outside world not be able to pick up on it. Whereas with a physical health problem, often the outside world can pick up on it. And I think if you're not well mentally, it's going to filter into everything in your life. And if your mental health is not within your control, you're in a very vulnerable situation. So I think the key thing is to reach out for help and take control of the situation. And if you're not sure whether am I just stressed because of exams and a bit anxious, or is this actually starting to affect me? Just, reach out for help anyway. There's lots of avenues of support that you can reach out for help. Make sure you have a support network, identify what's happening, seek out help, and take the time out you need to deal with this, because this is not like a career versus, I'm going to be prolonged. My career is going to take a year longer to get there because I'm dealing with my mental health. This is going to help. This is the foundation on which you live the rest of your life, your mental health and being happy and being able to function. So I think it's really important to identify that you need help and then to act on things. Personally, exam related, how to have come out of that experience, which I thought was quite by myself and to have, but having friends, the people who've gone through things like this is really important to. Again, I go back to the same thing. Teach yourself to be your best friend. Teach yourself to take care of yourself.
Have we lost Sharlini? Have we lost me? Hello, Anna?
Oops, I think we lost connection with Sharlini, but maybe you can answer, Fee. Yeah.
Okay, fine. I'll answer.
But you've answered already, so.
I was going to say something.
Yeah.
Shout out. Yeah, I was going to shout out to the Practitioner Health Program, which is free for doctors and I think dentists in the UK. And they will assess you. They will be set with the GP and stuff, and you can get free therapy through them. And they have changed my life. So yeah, it's pretty nice. They're all lovely people who try really hard.
Thank you. That's very helpful. I think also the BMA or the MDU might have similar outreach programs where you're able to contact them, and they have like a 24-hour helpline. So for anyone that is UK based, use those resources as well. And I think, unfortunately, we have written down so many more questions, but we don't have the time to go through all of them. Hopefully, we will be able to touch upon some of them during the Q&A at the end of the day. But Ines can read out the last question we wrote for you guys, which we think is very important.
Oh, sorry. So our last question was about having some tips from you. So tips, it could be for medical students, for doctors, anyone who's watching us today. I think Sharlini has a few slides to show us.
Yeah, I do have slides, so I'm just going to share my screen, yeah?
Nice to see you back.
Yeah, sorry about that. Don't know what happened.
It's okay. Things like this happen when you're online. It's fine, don't worry.
Oh, I did exactly what I wasn't supposed to do, which is share my personal information.
We're gonna steal it, Charles.
Yeah.
Oh, there we go. Sorry, just a tech tard. Okay, this is not very clear. Why can I not? Oh, there we go. Okay, here we go, finally. Top 10 tips for aspiring surgeons, but actually it's 15 because there are too many. Said it again and again, commit to being kind to yourself and others. Teach yourself to be your best friend. You will meet lots of people who are not like this, but I think you just need to choose to be this person. Be proactive and take initiative in your field of interest. So if you're interested in doing something, just, you know, like this conference, it's a product of people who have taken initiative to do something that they're interested in, and that will pay off. It'll pay off for your portfolio, but also it'll pay off because the more you're doing things that you're interested in, the more motivated you'll be, the more you'll network, etc., etc. Lift as you climb, send the elevator down. Now, from time to time, I'm like, you're just a CT2, you know, who do you think you are giving advice? But just, again, cast the imposter syndrome aside. Whatever level you're at, if you're a first year medical student, help people who are trying to get into medical school. If you're a fifth year medical student, help people who are in fourth year. If you're a CT1, help your F1s and F2s, etc. Lift as you climb, which was the name of one of the Royal College Women in Surgery conference names, which I thought was really good. So send the elevator down. When you're struggling, don't compare your journey to others. Commit to being better than you were yesterday. So that's The Man in the Glass, which I'll try and get that poem up for you guys. Keep working on yourself professionally, personally, and socially. So if you're learning 3 things every day, that's like you growing. In a week, you'll learn 15 new things. So just a little thing, when you start off as an F2 and you want to do surgery on F1 or a CT1, just try and learn 3 of the theatre instruments every day. Ask the scrub nurse, what's this called, what's this called, what's this called? By the time you get to the end of your F1 rotation, you'll know all the instruments that surgeons use, and that will give you like a competence and a confidence when you're in theatre. Learn to manage your time well, be organised and prioritise important things. I would say this is one of the biggest difficulties of being a surgical trainee or a trainee in any sort of challenging profession, especially, you know, you want to have a relationship, you want to have children, etc. Learning to manage your time well and prioritising important things is a skill that you need. So just learning to work smart and do things that are actually really important, and delegate and getting people to do other things. Get a cleaner, like the dust doesn't need to be your problem as well, etc., etc. Have goals and track your progress. Like I said, having goals has been proven to make you happier. Even if you have a year out and your plan is to travel, have some goals. It will just be better for you to know what you're doing and what you're aiming towards. Have a strong, high quality support network, people who nurture you and foster good mental health. That won't be everyone. As you get older, you'll realize there are people in your network that don't actually foster your mental health, and at that point you might just have to, you know, decide, well, how much time am I going to spend with this person. Make the shift from making unhealthy choices to making healthy choices, and that's an important one. I think as women, a lot of us have a tendency to go for the unhealthy choice, or we're conditioned to want the guy who treats us badly, or want the you know, the friend who isn't very nice to us, or to choose not to sleep, or, you know, just make decisions to not seek out mental health, that negative self-talk. I think to pursue a career like this, you need to be in a position where everyone else that we've heard from today, you can see that they've developed that ability to make healthy choices and put themselves first and do what's good for them. And I think that's quite important to think about and do. So make healthy choices that are good for you. And be proactive about having a work-life balance. So I found that when I was in medical school, I was really social, huge party animal. And then CT1, I was like, where are all your friends? And why do you have nothing to do this weekend? So what I did was, this year I was like, I think I need to make it easier for me to socialize, if that makes sense. Because if I'm so burnt out by the time that I want to socialize that I can't even be bothered to do something or decide or make the plan. So I made a list of things that make me happy, just little things. I made a list of things, like a restaurant list, which I'm happy to share, by the way. It's pretty epic. It's just a restaurant list of all the amazing restaurants in London, a things to do list, a countries to visit list. And then you've got, if you want to go somewhere, you just go to your list and you pick and you decide, well, this is what I'm going to do. It's kind of like being the pilot of your social life, if that makes sense. You've already made decisions about what you want to do. When you're feeling rubbish and you can't get out of the funk, which sometimes we get into a funk, if it's at a level where you think, well, it's actually really worrying, seek out help, seek out your support networks. If it's something you think, oh, I just need something to get me back on my feet, empower yourself by listening to positive, inspiring voices. So I will definitely be listening to Dr. Tasha's podcast, and I now follow her on social media because she sounds, I've gone back. She sounds amazing. But like conferences like this, when I was an F2, I wasn't sure if I was cut out for the job, and I went to a women in surgery conference and I was massively inspired, and I've never looked back. Family, friends, podcasts, life coaches, prayer, if that's what you need. Also get up and move, whether it's a walk or a run, just get up and do some exercise. I think it was Miss McNally who spoke about the power of exercise before, and it's really important. Learn to anticipate your challenges and pre-plan how you'll deal with them. Spoken about that a lot. Commit to bringing the joy to your day-to-day work and colleagues. Now, you might be in a job where you think, oh, I'm not having a great time here, I'm not feeling good about this, oh, I don't have any friends. If you commit to bringing the joy to your day, I think someone said, you know, you might as well, you spend 10 hours there or 8 hours there, you might as well commit to being a positive person and bringing the joy. Now, I know in my current workplace, we're doing a lot of baking during lockdown. Lots of people are bringing in cakes. Like, what a better way to, you know, bring the joy to your work. Like, everybody gets a piece of cake. Like, if you're going into a new environment and you've started a new job, bake. I know my new registrar, I thought he was excellent. He came in on his first day and he pulled out this loaf cake and he gave it to the scrub nurses and he said, I'll bake this for you. And I just thought, he's sorted for the rest of the year. Like, no one's going to give him any trouble. So just bring the joy to your workplace because it will help you. Remember to embrace and learn from your failures. If you allow them to be, they'll be your best teachers. So when you fail, you can either be like, oh, I'm done with this, I have no motivation, I can't keep doing this to myself, or you separate yourself from the actual situation and you work out how you're going to improve and seek help. Develop and practice confidence, which is having resilience, self-esteem, self-assurance and inner strength, which I think you do need in this job. So some people have it naturally, and if you don't have it naturally, then like work on it, and it's a process of working on it. I know I am working on it as opposed to having it naturally. So those are my 15 tips for aspiring surgeons. I hope they were helpful. And I'm just going to go to the poem as well because I think it's really good. So I'm not going to read it to you, but it's a great poem. And I remember that I think Southampton football manager was asked in an interview, how do you deal with stress? And he basically just recited this poem. I think sportsmen are quite good actually, because if you listen to sports coaches and sports players, they have quite good advice. So yeah, that's me.
That was amazing. Thank you so much. I know everyone will, I hope people took screenshots of the tips. But if not, I think it would also be a good idea to put it on your social media anywhere.
Yeah, absolutely. I will.
Yeah. Yeah, that was amazing. I think we'll now show the feedback form, if that's okay. And then I'm sure you guys will come back for the final Q&A as well. And we'll gather all the other questions that people want, and we'll ask them again in the final Q&A. Is that okay?
Awesome. Thank you. Thanks so much.
Thanks, guys.
Oh, thank you, guys. It's always so great to hear from you.